Hi, my name is Allan Frankel. I practice internal medicine in Santa Monica. I trained at UCLA and went into pretty standard internal medicine for nearly 27 years before feeling that my toolbox for treating patients for anxiety, pain, and many other illnesses was getting too small, and reaching for Xanax and Klonopin and Vicodin and other very addicting tranquilizers and pain medications became unbearable for me to write. And with prior experience actually in medical cannabis in the 70s at UCLA with the glaucoma studies and some cancer patients, I chose a career in cannabis medicine. I chose making a left turn in my internal medicine career nearly 8 years ago into cannabis medicine as I began to understand that cannabinoid medicine and the future of cannabinoid medicine would be a great replacement for many patients for benzodiazepines and pain medications, as well as the treatment of very many other illnesses. I was incredibly naive when I started, but over the last 7.5 years, we've all learned a lot, and medical cannabis now does fully integrate with the rest of my internal medicine practice, and for the most part, I have been able to use alternative to benzodiazepines and narcotics, and the majority of my patients can get off of narcotics by the end of the year. The cannabis plant is something I'd like to talk about next. It's one of the funnier things that I've heard is that there actually are caves where they found fossilized drawings of bongs and pipes that are about 100,000 years old. 100,000 years ago is the beginning of the Neolithic age when man got control of fire. So pretty much when he got control of fire, they started lighting cannabis. If that's not entirely true, it's closely true. And regardless, cannabis has been used for tens of thousands of years by man, and there's very good evidence for that. Tinctures, extracts are well over 3,000 years old. Edibles, at least a couple thousand years old. But the cannabis plant made a real, call it a right turn in the last 150 years because cultivation started changing from expanded families to more formal cultivation as part of the industrialized age. And I think the needs for pain and anti-anxiety treatment became less important, and the appreciation of the THC and stony value became much more important. And over 100 years or so, the other very critical cannabinoid, CBD or cannabidiol, was lost from the population. In recent years, and by recent years I mean 37 years, the medical community internationally has made it very clear how important CBD is, and our federal government patented it over 10 years ago. So without question, it's a very valuable molecule. Now in the last 4 or 5 years of my cannabis practice, as well as that of a number of other physicians and growers and chemists, we've made big strides forward in setting up laboratories to measure CBD levels, because you can't find a plant and verify that it has cannabidiol in it or how much cannabidiol in it unless you have a laboratory that's reliable. That was like a 2-year process. And now there's a lot of different strains that have different ratios of CBD and THC. So if people want the quote traditional plant, although I would argue the real traditional plant is the one with CBD, but you can get plants with high THC to get different effects, and some effects with high CBD to treat a lot of different illnesses that we'll talk about in a moment that don't get people stoned. Dr. Ethan Rousseau of GW Pharmaceuticals, and a wonderfully brilliant man, talks about cannabis and the entourage effect. But the entourage effect refers to the fact that the plant is a complex plant. It's a plant with 500 molecules in it. There are 100 cannabinoids like THC and CBD, CBN, CBG, CBC, on and on. Some of these are larger molecules, some of these are smaller molecules, but another small group of cannabinoids are called terpenes, and other alkaloid molecules and flavonoids. These are all molecules that not only give us the scent, the character, the taste of any plant, because these molecules are not unique to cannabis in any way and are found throughout nature, but these effects are extremely important clinically, and the whole plant effect is extremely different than just a pure CBD or THC effect. And that's why at least the group of science members that we're working with are aiming towards whole plant extractions. Now strains, people talk about strains all the time. There's classically actually three different groups of strains. There's sativas, indicas, and ruderalis, or the autoflowers. Sativa strains classically came from the equatorial areas and were in very, very heavy amounts up until 1980 when the very end of the Vietnam War ended. Indicas are more northern mountainous plants that are shorter and squatter, a little bit more frost resistant and shorter flowering times, a little more sedating. Sativa and indica mean daytime and nighttime in Sanskrit. And the third that I briefly mentioned, ruderalis, just for completion's sake, are a very interesting group of strains that are auto-flowering. In other words, they're not dependent upon a vegging cycle and then a flowering cycle. That's something would be good to look up. The problem with strain-based cannabis medicine is the strains change all the time. For those of you who've already been in collectives or dispensaries, it's very difficult to get consistent medicine. And for people who need something a little bit more predictable and reliable than the raw plant, extractions of cannabis, which have been done for centuries, have become very, very sophisticated. They're a pharmaceutical, a nutraceutical product, and now they're products that are active in the California medical cannabis system, and they're available for you. Let's speak for a moment about methods of administration of cannabis. I think the most commonly known method is smoking it, and the advantage of smoking it is that a lot of people enjoy it. It's a very rapid onset. You get very effective activation of the cannabis, which always involves heat at some level. The issue with smoking it is you're not sure what the strain is. The duration of action is not very long. I do not believe there's any long-term damage to the lungs from smoking, and I believe 35 years of research has made this pretty clear, but clearly smoking hot, fiery embers is going to irritate somebody's throat. Vaporization, another very, very common method, is where you take the raw plant, put it into a canister inside a device that heats it, and at above approximately 275 degrees, vaporization of the THC and other molecules takes place, and you leave the tar behind. So it's definitely a cleaner way, but again, you don't know what you're taking. Orally, cookies, candies, drinks, for many, many patients are very, very effective. My concern about them is they're not dosed. When dosing takes place on these edibles, people will be able to figure out a dose that works for them and keep repeating it. Right now, you have to be very cautious about edibles and start with very, very tiny pieces, wait a couple hours, and then take more. I'm asked all the time, what is dosed cannabis medicine? And I believe it's a little redundant to even talk about dosed medicine, although there probably are some medicines where doses are not very important. Most of us are very used to having dosage information. We go to the pharmacy and we want to get some Tylenol. We'd like to know what milligrams we're getting. Extra strength, what does that mean? Maximal strength, what does that mean? What do any of these things mean? Well, they always translate to weights and volumes and measures. And although the raw cannabis plant has many, many, many values and many of us enjoy it all the time, there are many situations where using the whole plant smoked or vaporized just is not practical. And besides practicality or social acceptance, it's just not the most effective way to medicate. For example, let's take your most common patient, somebody who is married, has a couple kids, or has other stresses in their life, there's financial issues, and they've got a stressful job, and their head is spinning all day long, and they're just waiting for the evening so they can go home and relax, and some people have their drinks, some people go out for a run, and a lot of people go sit down and smoke a joint. Is there anything wrong with that? Absolutely not. But I think there's something very wrong with saying that this is our main medicine when we can't use it during the entire day. But smoking then becomes impossible, and again, more for medical reasons, less for social reasons. Because if the medicine were best smoked, I would argue that we should do it smoked, but it's not. The best way to do it is to know what you're taking, to know how many milligrams of CBD is in your medicine, how many milligrams of THC. Is it a whole plant extract? Do you take it orally? Do you take it sublingually? Is it a spray? Is it a capsule? Is it a rub-on? But whatever it is, if it does not say on the bottle that it has X milligrams of CBD, X milligrams of THC per gram or per volume, it's not tested. I can assure you that when people in the cannabis world test their medications, they put the test results on the medicine, unless the test results are really awful. So I would only recommend getting medications if you want reliability and predictability that are dosed and have standards to them. So where can you find these medications, and how do you learn which ones are best for anxiety, which ones are best for insomnia, which ones are best for different types of pain? And sometimes, for example, anxiety, you want extremely little THC, and you may want an extract, either orally, oral buccally, sublingually, that has 8 times as much CBD in it as THC. If you have very, very bad arthritic pain or multiple sclerosis, you're going to do better with some THC in it. But how much? Well, this is between you and your doctor. And a new resource that's available, the Patient Information Center. And I would encourage you, if you have questions about dosable medicine or anything else related to cannabis, to just go to patientinformationcenter.com. Also, if you have any general medical cannabis questions, feel free to check out my own website, greenbridgemed.com. I hope you enjoyed this talk and look forward to talking to you again. Thank you very much.